I was so angry. I was so angry to be told when I was 28 weeks pregnant with our second kid that you're going to be fired unless you sign this contract. And I didn't know how else to cope. I've never been in a position where you're the doctor, you have the medical degree, you're the one who actually connects with the patients, but we don't actually care about you. Boundaries are self care. And I am more comfortable with that now than I had been as an employed physician. Direct primary care is truly something that is growing like wildfire in this country.
Welcome to DPC Life, the podcast where independent doctors share real stories, bold ideas, and the freedom of doing medicine on your own terms. I'm your host, Dr. Ann Gonzalez, and together we'll explore the wins, the struggles, and everything in between. Let's dive in. Hello, and welcome back to DPC Life, the podcast where we talk about how to build your practice to fit around your life and not the other way around. Today, I wanted to talk to you about another tip for getting new patients to your practice. And actually, this is more about getting referral sources to your practice. So it's festival season right now. It's the middle of October, and we just went to the Oktoberfest in Hickory. It's a 3-day festival, big festival, and I'm sure that there are festivals in your city, your town, similar thing. Lots of vendors, lots of craftspeople, realtors, just people from around the area who are out there to show off what they do, to sell things. And so these are people that have small businesses, and these are the people that you want in your practice, either their employees or themselves. Because a lot of times the reason why they have these second, I would call them side gigs, creating things is because either they don't have a regular employed job, or they do and it's not making ends meet, or they just really love crafting and wanted to share that with everyone. But anyway, we were supposed to have a booth at the festival. There was a miscommunication and we didn't have a booth, but they said you can just go around and pass out flyers if you want, since we had a raffle going on. And because we do aesthetics, we had a raffle for a facial, which is a really easy thing to sell to people. But if you don't do aesthetics, what you can raffle off is a gift card or a small gift basket, something that is fun that people wouldn't hesitate to give you their name and their email. The idea is that you want to get their name and email because you want to be able to tell them more about direct primary care and about your practice and why it's so much better than regular fee-for-service practice. So we walked around. We had a huge QR code on the back of the clipboard. We would walk up to the vendors and look at what they're selling, and then talk to them a little bit about it, and then ask them where they're from. Most of the time, they were from very close by. And then we asked them if they wanted to sign up for the raffle, and we told them where we were located and what we did. And most of the time, people were like, yeah, sure, I would love to sign up. The QR code took them to a page to sign up for the raffle. That way we have their email. It also had a link to go to our website in case they wanted to see more. But now they're in our email system, and they're going to get a sequence of, I think, 3 or 4 emails over the next week. And these are already timed. They are in the system to go out automatically, like immediately when they scan that QR code and put their name in. They get the first email, and then a day later they get the second, a day later they get the third, etc. So one of the easy things is making an automation, and that way you have a way to reach out to more people. The other thing is, if they are not interested in doing direct primary care themselves, they may know somebody, or if they have employees, that they might want it for their employees. It's really a win-win. It was a great day. We got to most of the vendors, and so it was actually a fun and pretty easy way to get new people on the email list, to meet other businesses in the area and just meet some new people. So that's a fun thing. If you've got festivals coming up, real easy, didn't cost us anything. And if you're going to raffle off something, it's going to be the cost of whatever you're raffling. The email sequences are one of the automations that have made things a lot easier for us. So you're saving time with this. And if you can sit down and set up your sequences, whenever somebody signs up on your email list, then it just automatically will send these emails to them. And just as I get older, I keep thinking about that Hamilton song, like, why do you write like you're running out of time? That one, I start, I'm just feeling that a whole lot more. That's one of the themes that I've noticed over the past several podcasts is trying to get your time back and use your time really efficiently. So the automations are great. And I actually have a solution for that. If you want to learn more about it, you can go to harmonyopshealth.com. And it's a whole system that helps you with automations, email automations, social media planning, and also has a website chat widget and voice AI. So those things will help you, especially if you are still in fee for service and you're trying to work out the rest of your contract. It's hard to answer the phone. It's hard to call people back because you are still busy doing other things. And so these tools can help you reach out to more people just running in the background while you're seeing patients and living your life and help you get more patients in even before you start. So go to harmonyopshealth.com and you can see more about this. So now on to our episode for today. We have Dr. Maryal Concepcion, and I feel she doesn't really need any kind of introduction. She is the founder of My DPC Story Podcast, which is going on its sixth season now. And if you have not listened to it and you're going to do direct primary care, you absolutely must listen because there are so many things that I learned personally from the podcast. And I still every Sunday look forward to listening to the new episodes. Yeah, that was the first podcast I listened to when I decided that I wanted to do direct primary care. And every episode has little gems in each one. Dr. Concepcion, thank you so much for being my guest. And here we go. Today, my guest is Dr. Maryal Concepcion of Big Trees MD, founder, physician, and also the founder of My DPC Story, which is an amazing podcast. That's what I listen to pretty much nonstop once I decided I want to go DPC. I was like, every week, I was like, yay, a new episode. Thank you for being with us, Dr. Maryal. Please tell us how you got into DPC because it's a really interesting story.
Oh, thank you so much for having me on. I'm so excited.
Absolutely.
Yeah, I'm so excited to join you. I would say that I had a very traditional experience after residency in terms of only knew that there was the way to go into medicine was to be employed. And so I looked for a place where I could do full scope medicine to the point of prenatal care. I did not want to do hospital medicine, emergency medicine, or actual deliveries, but I still wanted to do prenatal care. And I did want to find a place where I could do colonoscopies. And so I found a place where my husband and I could do a job share. He's a family practice doctor also. And we ended up coming to this rural town of Arnold, California back in 2015, right after I'd graduated residency, and I was able to do all of the things. And we were, my husband and I, doing a job share, intending to have a family. We did not have kids at the time, but we went into this community knowing that it was rural, knowing that we would be able to do full scope medicine, and we were on salary. So it was great. If there was snow on the road and only 9 people showed up for the day, like that's all you had and you didn't get dinged. That changed when the salary was no longer on the table and we were being pushed to go RVU based. And that ended in a 2.5 year ongoing frustration slash whatever, quote unquote, negotiation with the corporation. And then the corporation went extremely corporate. And so at that point, the people that we had been working with, the people who had been doing physician contracts for decades, they were all let go and the new company men were brought in. And so at that point, I was extremely frustrated that the things on the table that we were expected to sign were exclusivity. So if I worked for another company, the company that I was contracted with would own my money. I'm like, I'm sorry, who went to medical school? Because it's not the company, that would be me that went to doctor school. There would be exclusivity in terms of location. If I were needed in a market in Los Angeles, that they would have the right to move me. Non-competes, they're not enforceable in California in this situation, and other just not reasonable things like your RVU reimbursement will be set by us. We cannot divulge how we're going to set that, and it's going to be evergreen, so we're never going to change it. And
Wow.
I was just like, this is completely not okay. And so at that point, I was so frustrated. And this is back in 2019. and ironically, she just texted me earlier today, there was an orthopedic surgeon, Dr. Ariana Demers, who was leaving the same corporation to do her own thing. And she was like, you need to look into DPC. And so it very much speaks to me every time I see the Matrix and see Neo following the rabbit and taking the red pill. Like, I did not know what DPC was. And I didn't care that I didn't know what DPC was. I just knew that somebody said you need to look into DPC. And I was completely open to whatever DPC is. I will figure out what that is as I go on. So I went to conferences, still really not knowing what direct primary care was. And then when I realized that it really is old school medicine with modern technology and it's accessible to everyday Americans, I'm like,
Mm-hmm.
oh, and very much the passion that I have, and as do
Yeah.
you, for this movement, because it's so crazy to think that as educated physicians, it's sort of a hard thing for us to understand what it is until it's very clear, right?
Right.
That's how I got started in this whole movement.
Mm-hmm. Mm-hmm. Yeah. Yeah. Wow. And at that point, when you started in DPC, you had one little boy already, or it was your first child?
Yeah, I opened our clinic September of 20. So literally like 3 weeks, I think, after you opened yours. So 2021. So we would have had both Nolan and Asher. Nolan would have been just a few months old because he's a November baby. And so I had two at the
Oh,
time. Didn't
wow.
realize that until you just asked that. Yeah.
Mm-hmm. Mm-hmm. So how did you make things work? I mean, your husband was still at a regular fee-for-service job.
Definitely say, yeah, I would say that one, it's way easier. Those of us who have cared for little ones who are not yet mobile, it's way easier to like carry them with you everywhere. But I will say that when I opened, I was telemedicine home visit model only. And so and also it was during the pandemic. So we didn't have any daycare. Our oldest was with me basically all the time. He's definitely on, I think about Dr. Julie Gunther's podcast. Like I don't want to watch this movie on that
I think I
podcast. And
remember that.
yeah, but it's one of those things where it's like you just do because you have to. There's no other option. And so my husband would work, he would work, his regular schedule was still, I believe, like 2.5 days, or
Mm-hmm.
maybe it was three. I can't even remember. But he did not work 8 to 5 all of the days of the week. So
Mm-hmm.
we basically played it by ear as to who has kids, who has patience when, how do we make this all work? But we don't have family close by. We didn't have daycare. It's been a journey. Yeah.
Mm-hmm. Yeah. Wow. So you started out as mobile and home visits. So what made you do that? Was it just really the childcare situation?
Totally. Yeah. The fact that I didn't have to worry about negotiating a lease, the fact that I didn't have to worry about rent, and the fact that I could just do as much as I could from here. I think that I always wanted to have as much stuff done virtually as much as possible. And so it was a great exercise in that, but also just the sheer, like, you don't have to have a space, was like, that's as much thought as I gave it. Like, my patients were so happy to not have to go to an office. They were like, this during the pandemic, and I still have quite a few people who are older. You're geriatrics trained also. Those people who are like, I believe in science. I believe that infectious disease is infectious. Like, I don't want to expose myself to people. And so I also set boundaries for myself. If a person was eligible for full vaccination of COVID at the time, those are the only people that I would take in the practice. And that really helped me attract a panel of patients who are pro science, pro vaccine, pro, like, I have hesitancies, but I will discuss them with you versus listening to some Instagram influencer or google.com. And so that has helped us maintain a practice that has that culture, which is great.
Wow. I didn't even think about that. Yeah, I wish we had done that. Okay, well, great. After a while, you ended up getting a brick and mortar space. What caused you to do that?
Yeah, so this was before Jeremiah was let go of his role because Adventist Health went to a non-physician model. I am very extremely, and I'll always be vocal about that. But when it came to a physical space, I realized that there is a certain point, I discussed it with Dr. Cindy Richards also, that there's a certain point at which you can do only so many home visits in a day. And for me, typical home visit is 2 hours. So it's if I am doing 2 hour visits and exhausted mentally after each one, how many of those can I do in a day? And so that's when I said, hey, like budget wise, we have funds to afford a place. And it was $12.90 per month for this location in town. And it was a 6 month lease. And the building owners were really like local people, and they wanted their little like shopping center to be with really awesome professionals. And so they were really excited to have a medical practice there. But yeah, it really worked out because for $12.90 a month, and to have the ability to have a place to start stocking albuterol and nebulizers and doing things. I didn't have an autoclave. I was mailing my tools to other DPC doctors to have them autoclaved so I could do things like procedures in my clinic, or I would use disposable kits. But it was a great way to transition as the practice grew rather than committing to something up front that was really taking my overhead down into the red, or having a commitment when the practice wasn't growing.
Hmm. So you're growing your DPC practice, but then you had a lot of things going on. And I've never really, I didn't ask you this before, but did you know that you wanted to start a podcast sometime about some kind of topic, or was this just kind of, I have to do this because I'm talking to all these people?
I was so angry. I was so angry to be told when I was 28 weeks pregnant with our second kid that you're going to be fired unless you sign this contract. And I didn't know how else to cope. I love therapy. I see a therapist currently because mental health is so important. Like, we're recording this during the week of
Hmm.
mental health, World
Yep.
Mental Health Awareness Week. But I did not know. I've never been in a position where you're the doctor, you have the medical degree, you're the one who actually connects with the patients, but we don't actually care about you. I was so angry. And what I leaned on to cope was the fact that I had wanted to hear more stories. I got so irritated at DPC Summit when it would be like a panel of 3 or 4 people and they'd share for 5 minutes. And I'm like, that's not enough. Like, I want to ask more questions. And so I had some friends at that time in DPC who had been new in DPC for years, whatever. And it was leaning into something that I coped with, just that came naturally. Like, I love speaking with people. I love connecting with people. I mean, hell, we're family medicine doctors, but at the same time, it allowed me to connect with other people who saw how messed up the system was. And so it, like, even to this day, as I think about what is important to me, advocacy is one of the most important things to me, to my core, because it's me being with other people. It's not me being isolated in some island. It's me being and fighting for what's right. And especially in this time in our country's history, when people are not going to be able to get healthcare because of some unnecessary reason, and we as a movement can address that in any community, rural, urban, it doesn't matter. To me, that is really powerful, to stand with people like yourself and myself and elevate that as much as I can.
Yeah. Yeah, it's great. And so you also, besides the My DPC story, do a lot of advocacy in other places. So tell us more about that.
Yeah, pretty much, like, I will advocate anywhere I can for direct primary care because you have everyone around you is going to have a different reason why they do not like whatever their feelings are about healthcare. And so when I'm talking with people, I really appreciate, as a family medicine doctor, the ability to morph into any conversation, whether that person is a social worker who got laid off from the emergency room and is standing next to me at Trader Joe's, to a person who's on Capitol Hill and is working in a policy office where their senator has co-sponsored a bill in pro DPC. But I think that really what I found in terms of advocacy is the ability, and that's why I called my DPC story, is because it's not my story, but it is the story of everyone who shares on the podcast, because it is through story that I have really connected with people in an advocacy lens to help them understand what DPC is, that it is not concierge medicine, that this is something that is accessible to all people, that this is something that is an actual fix to healthcare, and that healthcare is not insurance. And so, advocacy wise, I am very, very verbose and very outspoken when it comes to my own state chapter of the California Academy of Family Practice. I attend the advocacy meetings there to speak up for and work with my colleagues here in California to elevate direct primary care, to make sure that it is defined as a physician patient relationship and we are not in the business of insurance. I advocate on the county level in terms of I hate that I had to bring VFC vaccines to my own public health department from my own clinic because there was no one there to vaccinate. And I love elevating that insurance is not healthcare in examples like that. I am actually going to be next Sunday in DC speaking at the Robert Wood Johnson Foundation policy meeting on healthcare. And through the DPC Coalition, I've definitely leaned into any time that a person wishes to talk about health policy when it comes to DPC, how DPC can be a solution, and that solution is multi-layered to any community. That is where I will be happy to advocate. And I think that it's through things like the coalition existing, because unfortunately the DPC Alliance cannot, in their bylaws, they're not taking a political stance. So I had to find somewhere else to advocate. And speaking with my colleagues, especially Dr. Garrison Bliss, who started this whole movement, and Jay Keese, and people from all over the country going to Capitol Hill and advocating, it just feels so amazing to be able to help elevate our movement through the voices that we all have, that we all are making loud and clear, because people, meaning our patients, are desperate and wanting the care that we're delivering.
Yeah, absolutely. And the advocacy, it comes in so many ways. So you're advocating for your patients, you're advocating for the doctors. So not only on Capitol Hill, but then also you have other things that you're doing as well. I don't know how you do it all.
Yeah, I will say that it is, I'm very much leaning into the entrepreneur world of GSD. I don't know if that is if it's okay to cuss on this podcast. So the get shit done mindset is definitely a crutch in my life. And so I have very much learned to figure out delegation. It's not my easiest skill, because I'm very much I can do it, and I can do it quickly, and I can do it like whatever it is. Like I can figure it out. And I love, it's very family medicine of me, but I love that mindset. But also with entrepreneurship had to come, I cannot do it all in 24 hours in a day.
Yeah, definitely. Yeah, having a team and having a team that you trust is really important. And yeah, it's
Yeah.
hard to let go of that, like you said,
Yeah.
because I mean, I think that's just part of our nature. Number one is doctors. And two, if you're going to have an entrepreneurial kind of mindset, yeah, definitely is hard. And I think there's a book that's called Buy Back Your Time or something like that.
By Dan Martell. Yeah.
Yes, yes. And there's things that I think like laundry, no more.
Yeah.
Cooking, I mean, I've been cooking for my family for 20 something years. I am tired of it. I don't want to do it anymore. And I very rarely do anymore. I
Yeah.
tell my family, I'm like, I love you. I show my love in other ways besides cooking for you.
Totally. Totally.
Yep. So tell me about the DPC directory.
Yeah. So it was very apparent that through conversing with our colleagues, that people were really leaning into the podcast because of the resources that were shared. And that's awesome. That's what I love. That's what I am, one of the things that I'm grateful for, because people are going to approach DPC in different ways. Like I approach DPC in rural America. I don't have Rite Aids anymore around me. So it's like the people who are talking about an urban setting are going to be heard differently from people who are around settings like theirs. So for me, when I was talking with people, I kept realizing that resources and edible resources were very much needed. And it really did not sit well with me that depending on what your algorithm was during the day, like that's what you would see in terms of your resources, unless you did. And I joke, but also I think she's awesome. Dr. Lynn Pritchard was like deep dove into every single freaking post that was ever made on DPC since 2016. I say that just because like that is absolutely a freaking way to make sure that you're thorough in your resource search. But at the same time, not everybody is going to be on Facebook. Not everybody is going to be able to do that. And there are no other resources really out there where there was a way to read about people's experiences with that resource. For example, Shauna Sanders, who is an amazing lawyer, especially in the DPC space, people are leaving her reviews on her Proviso legal site on the DPC directory. So if you're looking for a lawyer, you don't have to worry about, is it in my algorithm today that I can find a DPC lawyer? No, you can actually go and look somewhere in a public setting now. And so it was very much created out of what I saw people needed, just like I needed to talk with people about their DPC stories for the podcast. So it was very much in tandem with the community's needs and what I saw them asking for that wasn't being provided.
Mm-hmm. Yeah. And just the buy back your time, Dr. Pritchard, this deep dive back to 2016. I mean, how many hours did that take her?
Yeah.
And so having that kind of resource is great because that's really the one resource there's no value on it. So
Yeah.
that definitely will save a lot of people time
Yeah.
and effort in trying to find what they need for DPC. So that's great.
Yeah.
And then what about Rise Up? Tell me about that. I've seen a little bit about it, but I don't really know
Yeah.
what that is.
Yeah. Another thing that I realized on my journey in DPC is that there's constant questions about side gigs. How do I find another way to fund my DPC because I'm the primary breadwinner, because of whatever fill in the blank I need to make this mortgage payment, da, da, da. And also the questions about how do I do this as a surgical specialist? How do I do this if I want to do OB, but I'm family medicine? I don't necessarily have a place to do these things, but I want to do them. And so when I was connected with the FlexMed staff group, so Dr. Erin Morgenstein, who's orthopedic surgeon, and Dr. Holly Shen, who's OB-GYN, it was completely eye-opening to see that there's a completely in tandem group of doctors who are doing locums and direct contracting, meaning they're not having to use a broker, a third party, to negotiate a contract. They're able to do their skills and they're able to directly contract with facilities, whatnot, even in their own hometowns, as well as Dr. Naomi Lawrence Reed, who talked about side gigs. This whole world was like they're answering the questions, and I didn't even know that they were in existence. And we collaborated over the summer and said, hey, it would be really awesome to bring more physicians to the table, not just the 101 content that we see at DPC Summit, but going beyond that and having the actual tools to how to direct contract, how to do locums gigs, what are the rules of engagement so that you are presenting yourself and not having a company present for you. What are the ways that you can be opted in or opted out of Medicare and still do side gigs? What are the things that you can do as a side gig, even if you're a pediatrician? So I think that it was very eye-opening and just leaning into expanding the education opportunities for a DPC doctor, but also somebody who is not necessarily primary care, who's interested in DPC as well as maintaining their level of care that they're able to deliver, especially when it comes to surgery. So
Mhm.
we decided over the summer that let's collaborate because the doctors who are wanting locums and direct contracting don't necessarily know what DPC is and vice versa. And so by creating a summit that is touching on DPC, direct contracting, and locums, people are going to be empowered in different ways that we haven't seen at conference before.
Mhm. Yeah, I had no idea either. And that's really great because yeah, definitely there are a lot of doctors when they're first starting, they are doing locums.
Yep.
The only way that they know about it is to go through these agencies or companies, and I guess that's not the only way. So
Yeah.
that's
And
awesome.
it's so to hear what can happen when you actually go into this autonomously versus through being an employee, it is incredible. But you have to be strategic about those avenues of finding work. And it's like talking with Holly and Aaron and all of their content, it's like a crib sheet for how to go about the act of doing your own contracting. And
Mhm.
it is not, people are like, oh, I don't want to open a business. Like literally having a crib sheet helps with the stress of doing the act of going to get a locums job. And it does not have to be at an urgent care.
Okay. Yeah. So what they help with is, so if I wanted to find a locums job and I went to them, I can learn how to create a contract for myself to contract directly with someone who needs a locums. Is that correct?
Yeah, so definitely in part, I would say not only like where like how to do it with a contract, but also where in terms of which companies are going to be friendly for independent physicians, which companies are going to be making you work like a dog, which companies are going to be allowing you to have a single day malpractice coverage policy, which locations are going to be more friendly for a fair compensation versus others. So it literally is the world of direct contracting and locums. Anything and everything you need to know. They've been doing it for so long that they've created this whole education platform of how do we empower physicians to do what we're doing in DPC in terms of be autonomous in their practice, but be autonomous in their practice through direct contracting and locums, as well as other side gigs. Yeah.
Do they help physicians find locums? Is that
Oh,
part of
yeah.
it?
Yeah.
Yep. Hmm.
Yeah, absolutely. I mean, every day there's even conversation chats about, hey, I'm in Florida, like trying to figure out if this did, and there's so many physicians and flex med staff who are helping people navigate how to not lose their minds over
Hmm.
the finances because they're empowering people to make money, but also not give up their autonomy.
Hmm. Hmm. Yeah. And it's called Flex Med Staff, right? The company.
So FlexMed Staff is the company, and then the summit is the Rise Up Summit. So it's just at flexmedstaff.com/rise up. But yes, it is just a collaboration between My DPC Story and FlexMed Staff.
Okay. Yeah, great. Well, that's awesome because that is something for sure that I think a lot of DPC doctors they would love to know that because
Yeah,
a lot are solo, right?
correct.
And the coverage is a huge issue, especially if you're in a rural area and there's no other DPC doctors around you.
Yeah. And I will say that, like many people, I've gotten the flyers from the Chicago, here's the side gig conference, da da da. But it's $1,000 to go. And then if you want to learn about this side gig, it's another $700 and da da.
Oh,
And this
mhm.
is, yeah, this is like that. I mean, it gets crazy and you have to go to Chicago for that one. But this is completely virtual. It is 3 days of it's pre-recorded content. It's 3 days of virtual content. You get the recordings for 6 months after, so you can listen to the content and digest it on your own time. But also, we're going to have a live day of Q&A. So like when you're looking at less than $300 to attend a conference like this, when it's literally a crib sheet for how to make way more than $300 even with one contract or one side gig, it is, to me, it's like a no-brainer. But
Mhm.
that's why we made it accessible too, so that it wasn't thousands of dollars and that it could be accessible for people who are starting out, especially.
Yeah. Yeah. And that's exactly how you really need to think about it is, yeah, it's $300 up front, but
Yeah.
you put it on your credit card and then you get a contract and you've paid it off.
Yeah. Yeah.
Yeah. Okay, you've got lots of stuff going on. What about outside of your business interests in the DPC? What do you like to do?
I love talking with people. I say that jokingly because literally it doesn't take a lot for me to get excited about doing stuff. If there are other people involved, I very much love activities like that. I definitely love seeing my girlfriends from high school and college and going to dinner with them. My husband and I are excited. We have a like 4-day trip to San Francisco that we're planning, just the two of us. And so I love hanging out with him. I love Legos. I love my paint by number that I got. It's super cute from Target. It's like a ghost with flowers around it. I'm super excited about that. But yeah, it doesn't take much to make me happy. Oh, that sounds fun. I've never done that before. Let's do it. So it could be anything, but I think that that's where, as a doctor who's got all this time, that you don't have to be with patients in the clinic 8 to 5. Filling it is never the problem, but also just recently, because I just came from a retreat, I'm really focusing on really paring down on what really brings me joy, what brings like, how do I support my authentic self? And how do I elevate my functional adult and lean into that when I'm healthier in all of my experiences with other people, my kids,
Mm-hmm.
my husband. So I just really love that in direct primary care, because you can create the world you need to, this also allows you to take care of yourself. As selfish as that sounds, boundaries are self-care. And I am more comfortable with that now than I had been as an employed physician.
Yeah. Yeah. And so the flip side of that, besides the reverse of what do you like to do outside of medicine, is what are you saying no to now?
Yeah. I'm saying no, definitely to a lot of people are wanting to pick my brain, have me do consulting for free. And I'm like, I have given so much. My podcast is free. I am not at a point where I am willing to work for free, basically. When it comes to other people wanting to develop a tech for this movement or whatever, have me as a speaker, I think that saying no to things that are making me work harder than the person who's asking me to, that I'm saying no to as well. And I'm saying no to, this is gradual, but saying no to the things that I can either automate, delegate, or eliminate. That is totally my hardest thing right there. But it is very much needed to keep the foundation solid going forward.
Mm-hmm. Yeah, definitely. I like the idea of the paring down, like I'm saying no to cooking. Well, thank you so much for your time. Before we finish, is there anything else that you want to tell people about DPC or just share with the listeners?
I would just say that direct primary care is truly something that is growing like wildfire in this country. So if there's anybody listening and they're wanting to learn more about DPC, listen to all of the episodes on DPC Life. Listen to your local DPC doctor, because DPC is in all 50 states. Go have a coffee with them, lunch, tea, whatever. But this is not some voodoo medicine type of like fringy movement. This is literally a physician having a relationship with their patient. And so if you're on the fence about what is DPC, that is always going to be defined by you from your experiences listening to other people, and how you lean into DPC is going to be different. But I will say that in that spirit of leaning in and creating your own understanding of DPC, that is also leaning into who you are as an authentic person, who you are as a person who needs certain things in the world and doesn't need other things in the world to move forward, whether you continue in medicine or not. I definitely would say that that's what I would really encourage people to think about in terms of how does DPC allow a person to understand what we're doing and experience that for themselves. It's up to that person to lean in and learn.
Mm-hmm. Yeah, it's a lot of self-discovery for sure. Yeah. Okay. Well, final things. Tell us how to find you.
The simplest way would be mydpcstory.com. You can find the links to all the podcast feeds and social media there, but mydpcstory.com is definitely where to start, or you can look up DPC in any podcast platform and it'll be there as well.
Okay. Yeah, definitely. I encourage everyone who's listening, definitely listen to all of them. It's been 4 seasons, 3, 4?
We're
No.
going to be in season 6 next year.
6,
So
holy
yeah.
moly.
Yeah.
Wow, that's amazing. That's incredible. That is quite an accomplishment. Well, Dr.
Thank you.
Concepcion, thank you so much. I am so glad that you came on. I'm glad to be able to call you a friend and say I know her when I see my DPC story come up.
That's awesome. Thank you so much for
Yeah,
having me. It's been such a
sure.
pleasure.
Thank you for listening to DPC Life. If today's conversation inspired you, hit follow, leave a review, and share it with a friend who's ready for change. Remember, wherever you are in the journey, your DPC family has your back. Until next time, keep building a practice and a life that truly fits you. This show is brought to you by DPC Ads in Minutes and Harmony Ops Health, helping independent doctors like you grow and thrive.